Esmailka, Life and Balance Physical Therapy. So a little background about me. Thought I'd add a little joyous picture there from graduation because no one looks good in a doctoral robe. But a little bit about kind of my background and how I got into physical therapy, which actually made it kind of tough to write my bio, is I've actually known I wanted to be a PT since I was in high school. So I was in a sports medicine program, was a student athletic trainer, and just realized, as some of you know, as I've talked to my one-to-ones, my biggest thing with clients is goal setting. That in athletic training. And so I had to find a different path on how to help people get back to their sport. And so I had a great mentor in high school that kind of shoved me down the path of physical therapy. So I went to undergrad and got my bachelor's in biology up in Alaska, which is where I'm from, so that wasn't a weird choice. Then came back to UW and got my doctorate in physical therapy. And then in PT school, I really decided I wanted to specialize in manual therapy, and I'll explain a little bit of what that is later. But while working, I decided to do a one-year residency and then a one-year fellowship in manual therapy. So that was just a bunch of extensive training on how to get those hands-on skills. So a little bit about, I throw around a lot of jargon sometimes. Some people don't know what is outpatient orthopedics, which is what my clinic is. So we're a small outpatient facility down near Michael and Rob's office on California. And outpatient is basically, it's mostly musculoskeletal, which is another, jargon. Anything involving muscle, tendon, ligament, bones, joints, could be a neck or back issue. So the primary things that we treat in our office are neck or back dysfunction, and that could include, a herniated disc, or even a slight fracture, stress fracture, something like that. Pre and post-op surgical patients. We get a fair amount of car accident-related injuries in there, sports-related, work-related injuries, and then something that people don't think really can be a physical therapy client is chronic diseases, such as arthritis, or like I just got a gal the other day that has lupus and is having difficulty being active with her disease. Other things, like other types of arthritis, like rheumatoid arthritis or fibromyalgia. Those are some of the different types of chronic diseases that people come into our office for. And then also, not something I treat, but some of my colleagues do, is women's health. So this is sort of just a little view of our clinic for those of you that haven't seen it. So it's sort of taken from the view of the lobby, and then on the left-hand side, there's a couple treatment rooms. And something I don't talk a lot about in here is we use Pilates as one of our tools for exercise. So there's a little Pilates machine in the back, and then around that half wall we have a second Pilates machine. But I do a lot of body weight stuff, and then I use some of the springs to do sort of a physics approach to exercise. But most of it is, and I'll speak on it again later, but it's not anything like what PJ does. It's not traditional training. It's not personal training in that realm. It's really specific to what the client needs for their injury. So a little bit of kind of what we do and what we don't do is we do offer one-to-one treatments for 55 minutes, but almost an entire hour, which is almost unheard of. I mean, when's the last time you saw your doctor for an hour? Usually it's like 15 minutes and they're like, okay, gotta go, I have another patient waiting for me. What we don't do, what some of the other physical therapy clinics do that kind of sets us apart, is no aides or assistants. So anyone you see in my office, even if it's not me and another physical therapist, you'll be one-to-one with that therapist, someone that has a graduate level degree for that 55 minutes. We do offer early and late evening appointments, which is kind of unique to this area. So what we don't do is close the doors at 5. I usually start at 7 or 7:30, and we take appointments up until 8 o'clock. So even those of us working folks that have the 8 to 5 job, we still accommodate that in the late evenings. Occasionally someone works a half day on Saturday if it's requested by multiple clients. I personally specialize in manual therapy, which means I don't use any modalities, another jargon, but that's basically any external device that's either attached or placed on the patient to help them with those injuries. So I don't use ultrasound, e-stim, even ice, heat, hydrotherapy. Those are things you can do on your own time. I don't need to charge you, hundreds of dollars an hour to do that sort of thing. And then offer a personalized exercise program that is related to the specific injury. So since I'm getting rushed along by Larry, what is manual therapy? Always a good question. And it's a little bit hard to define, but basically the two things that I really focus on, and I'll show you another slide with a little diagram in a second, but basically through the evaluation process is I really narrow my evaluation to finding the tissue in lesion. What does that mean? It's finding the specific ligament or tendon or even joint or something as specific as not just the joint, but the joint. Is it the joint capsule? Is it the joint cartilage? And then using that tissue and lesion, as I call it, to each different tissue has an optimal stimulus for repair. It's not just, for bones it's compression, for ligaments it's, tension in the line of those structures. So this is hard to read, but basically at the top it shows all the different tissues or joints, joint capsule that it could be, and then from the bottom up on the left is sort of my process of how I go through looking at each patient. So I do take that full hour, the first session, to evaluate someone and find based off of how they move and how they walk and how they stand and how each joint looks from a biomechanical perspective, whether it's in dysfunction or not, and how to fix that. So instead of telling you every week like I do my optimal patient, I thought I'd take a little closer look at my caseload and what I'm seeing right now. So I see 40 hours of contact time. Some of those are twice a week I see someone. And so I see about 3/4 female to male. I'd like that to be a little closer to 50-50. And then I broke it down into different regions. So I'm 30% low back and 10% neck right now, and then a little bit of a grab bag of everything else. I do love working with the extremities. I have a couple great shoulder and elbow patients, and then a little breakdown of the types of injuries that come in. So it's roughly 20% acute, 40% chronic patients, whether those are injuries or some of those chronic diseases, 15% post-op, 10% car accident, and then a little bit of work-related injury. And then my last slide here shows the age demographics. So starting with the bright blue one at the top, that's my youngest age group. That's that middle school, high school patient. And then going down from there, the bulk of my patients are in that 30 to 70 range. So I do take a little bit of everyone, even though that might not be my desired client group. But so hopefully you guys have a little understanding more of what manual therapy is and maybe how to refer someone to me. So thank you.